Epigenetics is the study of gene expression, not the genetic code itself, but how genes turn themselves on and off. Now, one of the biggest factors in epigenetics is something called methylation. Now, methylation is basically adding a methyl group to a molecule. Now, a methyl group is a carbon atom surrounded by 3 hydrogen atoms. Now, on the left side of the board, I have 3 ways that we use methylation. The first way is that we methylate toxic metals. And when we methylate toxic metals, it helps us clear these toxic metals safely. We also methylate viruses, and when we do that, it shuts the viruses off for us. And we also methylate histone proteins. Now, histone proteins are these large proteins found in the nucleus. And DNA wraps themselves around these histone proteins, and when we add these methyl groups to these big proteins, it causes the DNA to bind tighter to these histone proteins, and it shuts these genes off. Now, histone proteins are slightly alkali, and DNA is slightly acidic. So when we methylate these proteins, it causes the DNA to bind tighter to these histone proteins, preventing them from being turned on. Now, we can actually methylate the gene itself. Now, this is basically the dogma in biology. We have a gene that is transcripted to mRNA, and it's the mRNA that is transcripted to a protein. So when we methylate the gene, when we add these small methyl groups to the gene itself, we prevent the gene from transcripting mRNA. It shuts the gene off. So there are 2 ways that methylation is directly involved in gene expression or epigenetics. Now, out of a 30,000 person database, about 70% of these people were normal. 22% were undermethylated, and 8% were overmethylated. However, in the mental illness population, more than 66% of people with mental illness have a methylation imbalance. Now, over here on the right side of the board, I illustrate 2 case studies of schizophrenics, one being overmethylated and one being undermethylated. So the person who is overmethylated also suffered high levels of copper and low levels of zinc. And the nutrient program that Dr. Walsh added along with their medication program included folic acid, zinc, niacin, B12, vitamin B6, vitamin C, and vitamin E. Now, this individual also had high norepinephrine and high dopamine and low GABA. So the objective was to lower the norepinephrine, dopamine, and raise the GABA levels. And these are neurotransmitters. And in the second case, we had a schizophrenic who was undermethylated. And with that program, Dr. Walsh prescribed SAMe, methionine, calcium, magnesium, zinc, serine, vitamin A, B6, C, D, and E. Now, both of these patients actually had their symptoms get worse for a marked amount of time in the very beginning. However, they dramatically improved over the next 6 months, and even more so after about a year of staying on these specific vitamin protocols along with their prescription medications, which they were able to wean down on after about a year. Now, we also express personality traits that are associated with being either overmethylated or undermethylated. So if you are overmethylated, you are likely to suffer from high anxiety, you have excellent social skills, many friends, you're non-competitive, artistic, and you have a tendency to have chemical or food sensitivities. Now, if you are undermethylated, you tend to be a perfectionist, you have strong will, high accomplishment, you can suffer from OCD, and also have seasonal allergies. So if you feel that you have a collection of either overmethylation or undermethylation, you can try to include foods that are more geared to fit your personality trait if that's something you want to change. So anyways, this is Epigenetics Part 1, just going over the definition of methylation and a couple of examples of how we use methylation in the body, with schizophrenia being highlighted here as examples of people who are either over-methylated or under-methylated, with some adjectives to describe people's personality who could either be, express either over-methylation or under-methylation. So, epigenetics part 1.